So we presented a poster regarding our phase 1B study that was started in 2019. And we are now approaching 60 months for our patients who have been in this study. That being said, the poster presented our 36-month data. So a little overview of the study per se. So it's a small open label study of only 11 participants who are randomized into a mild cohort and a moderate cohort. They all received imaging, neuroevaluations, and then they all underwent the surgical one-time procedure. And then after that, they were followed up every 3 to 6 months with imaging and neuroevaluations until they've reached their long-term follow-up, which is what they are all in at this moment. We've recently published our phase 1B 18-month data, which is one of the reasons we were able to move on to a phase 2 study that started enrollment in 2024. So our phase 1B 18-month data was quite impressive in our moderate group, where we actually saw a 50% reduction in the MDS-UPDRS off in the moderate group, and then stabilization in our mild group. And then when we looked at our PD motor diaries, we were able to see stabilization in our mild group with a 33% improvement in good on time in the moderate group and a 25% reduction in off time in the moderate group. So, like I said, because of this impressive data that we were able to see in our phase 1B, we were then able to start our phase 2 study. That being said, when we presented this poster at ATMRD, we were able to present our 36-month data, and our 36-month data showed pretty much stabilization going through 36 months for our mild group, with maybe some mild improvement in off time of maybe about 10 points or in a reduction in their off time. And then for our moderate group, we actually saw that sustained improvement of almost 20 to 30 points in the off period for our moderate group as well. We did have a couple of outliers in our mild and moderate groups. The mild group had an outlier that was found to have a tyrosine hydroxylase deficiency. And so if you actually remove her data, all the data points seem to be straight. And then with our moderate group, there was one participant that did return to baseline with all of his assessments. And that was secondary to disease progression, we believe. One of the more impressive things that we were able to see also with our moderate group is that there was a reduction in levodopa or no change in their levodopa, and those participants were able to sustain that throughout 36 months. So given that we are a gene therapy company, so in this case, when I say gene therapy, we are working on what's called gene transfer. So we use a viral vector, AAV2, and the transgene of GDNF, which is glial-derived neurotrophic factor. And so we're hoping that by using this specific technique of vectorizing GDNF and then using a surgical approach to reach the brain and the putamen, that we are able to help regrow dying dopamine cells by the use of the GDNF protein. So our aspiration is for us to be a neuroprotective, if not even a disease-modifying therapy in the long run. Obviously, we can't say for sure because this was an open label study. If this is truly the case, given the fact that we know with Parkinson's disease, a placebo effect can last up to 18 months, if not even longer. But these are hopeful results to be able to see sustained improvement at even 36 months. Our phase 2 study is actually a double-blind, placebo-controlled study or sham-controlled study. And it's actually occurring only in our moderate group, not in a mild group as before. We are looking for participants who are between the ages of 45 and 75, who've had the disease for anywhere from 4 to 10 years, and have a decent amount of off time in their day. And basically, what we're trying to achieve is to see if this truly is a medication or a therapy that actually can, like I said, slow down the progression of the disease by looking at not just a group that's gotten all, like every single patient's gotten the medication, but also participants who haven't. We are randomizing in a 2-to-1 fashion, so two to the active group, one to the control group. And when the last participant hits 18 months, we will unblind this study. And if we deem the study to be safe and effective, we will have an open label extension for those who are in the control group. So if they meet inclusion and exclusion criteria for an independent protocol for that open label extension, then we will offer those participants the opportunity to get this therapy.